No matter how good your oral hygiene is, everyone can benefit from some professional help. For some people, visiting a hygienist is all that stands between them and losing their teeth, whereas for most people, it means healthy gums, clean teeth, and fresh breath. Dental hygiene method. At the Modern Dentist, our hygienists use a combination of methods depending on what it is you need. At every appointment, they will update your history, find out about any changes in your medical history or your home cleaning routine, and then they'll carry out a full assessment of your gum health, teeth, and overall oral health. Depending on what they find, they will then carry out a routine hygiene appointment involving removing tartar and plaque and stains from the teeth using a combination of scalers, ultrasonic machines, and airflow, or they may recommend a more advanced or deeper clean under the gum, often with the use of local anesthetic. What does the dental hygienist use? The dental hygienist uses a combination of materials and techniques, including hand scalers, which are specialist instruments designed to clean hard tartar off the surfaces of the teeth. These come in all shapes and sizes for all the different surfaces and shapes of the different teeth that the hygienist is trying to access. They also use ultrasonic scalers, which are designed to gently disrupt and agitate the tartar that sticks to the teeth. They use airflow, which is a high pressure stream of air, water, and specially formulated powder to remove stubborn stains from the teeth. And they use polishing, brushes, and pastes to leave the surface of the teeth clean and smooth. Benefits of visiting a dental hygienist. Healthy gums. This is the most important reason to visit the hygienist regularly. Healthy gums are an essential part of good oral health and general health too. Clean teeth. No one likes dirty teeth, and a dental hygienist is your best friend when it comes to keeping them pearly white and spotless. Fresh breath. The vast majority of bad breath comes from gum problems. A hygienist will help keep these at bay and make sure that your breath stays nice and fresh and clean. Motivation. A lot of people find that after they've seen the hygienist, they are really good at flossing and interdental brushing and doing everything properly, but after a few months, things start to slip. So seeing a hygienist regularly can keep you on top of those really good habits and make sure that things don't slip. Preventing tooth loss. Untreated gum disease eventually results in losing some or all of the teeth. Seeing a hygienist regularly is the best way to make sure that this doesn't happen. So what happens at a hygiene appointment? The first thing that happens is the hygienist will have a chat with you to discover any changes since the last time they saw you, to update your history, your medical history, and find out if there's anything they need to be aware of in terms of your cleaning or your overall health. Then they'll carry out an assessment of the gums and the teeth and check how clean everything is and how well you're doing at home. If they think that your brushing or your home hygiene routine needs some tweaking, they'll often use a plaque disclosing solution, which stains the plaque so that you can see the areas that you've been missing when you've been cleaning at home. For removal of the hard tartar that tends to build up around the teeth, they'll use hand scalers and ultrasonic cleaners to break this up and remove it. They'll also use the airflow, which is a high pressure stream of air, water, and especially formulated powder to remove stubborn stains and build up on the teeth. And they'll use a polishing paste and brush to leave the surfaces of the teeth nice and glossy and shiny. This makes them more resistant to stains and to tartar buildup in future. How much does hygiene treatment cost? At the Modern Dentist, a standard 40-minute hygiene appointment costs £120. If at your next visit, the hygienist recommends that you come for a longer appointment, a 60-minute appointment is £180 and an 80-minute appointment is £240. These costs include everything that the hygienist provides, including airflow and things like fluoride varnish if they recommend something like this for you. At the Modern Dentist, we don't have any hidden costs. Our advice on good oral hygiene. Firstly, use a good electric toothbrush. These days, electric toothbrushes are so far superior to manual toothbrushes. They're much more efficient and just do a much better job of plaque removal. We recommend any brushes from the Philips Sonicare range. Cleaning in between the teeth is essential, either using floss or TP brushes, or a combination of both. Your hygienist will advise you on what's best for you when you come for a hygiene visit. Surprisingly to a lot of people, mouthwash is not useful or necessary, except in some very specific circumstances, usually where there's acute infection, in which case we will prescribe a special medicated mouthwash to help things heal. How often should you see a hygienist? For the average patient, seeing a hygienist every 6 months is perfectly adequate. However, for some people in the higher risk categories, people with gum disease, we recommend seeing the hygienist every 3 to 4 months. And then some very lucky people are fine with just seeing the hygienist once a year. What are the signs of poor oral hygiene? The most important sign of poor oral hygiene is bleeding gums. Healthy gums don't ever bleed unless you injure yourself. So if you're regularly seeing blood when you brush or floss, you should definitely seek professional help. The other signs to look out for are visible plaque or tartar or staining that's built up on the teeth and can't be removed when you clean at home. What is the most common oral hygiene condition? By far, the most common oral hygiene condition we see is gingivitis. This is when the gums get swollen and inflamed and bleed easily when brushed or flossed. This is very different to periodontitis, which is a more severe disease that causes bone loss and loss of the supporting tissues of the teeth. How can I maintain good oral hygiene? By far, the most important things you can do to maintain good oral hygiene are use a good electric toothbrush twice a day, clean between your teeth once a day, either with floss or interdental brushes or a combination of both, and see your hygienist regularly. Can you recover from poor oral hygiene? The good news is everyone can recover from poor oral hygiene. If you think you're suffering from this, then you should definitely come and see a hygienist to get some advice on what you need to change and to get a kickstart from the hygienist with getting things back on track. Can a hygienist get rid of gum disease? When we diagnose a patient with periodontitis or gum disease, we will usually recommend a course of treatment with the dentist and hygienist. The aim of this treatment is to stop the disease in its tracks and prevent it from worsening. And then once we get to the stage where it's been stabilized, it's a case of giving you a maintenance routine to make sure that you keep the gums healthy. In some rare cases where the gum disease is severe and doesn't respond well to treatment with the dentist and hygienist, we may refer you to a specialist. How long does it take for gums to heal after seeing the hygienist? Gums heal incredibly quickly, and usually after seeing a hygienist, you will see a massive improvement within just a few days. For more severe conditions like gum disease, it can take up to 8 weeks or so before we see full healing of the gums and tissues supporting the teeth.